Fascinating article in Politico magazine by Harold Pollack. Now he says, look, I'm liberal, he says, and I'm in favor of the Affordable Care Act. But he had never talked about before about whether it would save lives. He talked about the quality of life that you would have if you have insurance, peace of mind, your health would be better throughout your life, et cetera. But now that there is a new study out in the Annals of Internal Medicine by Benjamin Sommers, Sharon, and Katherine Baicker, he's decided to write about it, and it's a really great piece. And what those researchers did was they studied RomneyCare that started in 2006 in Massachusetts. Now, it's not exactly the Affordable Care Act, but RomneyCare is actually very similar to Obamacare. And they studied a tremendous number of people, their health before the act passed and then after the act passed. Now, likely the Affordable Care Act actually will affect people at a greater rate because Massachusetts already had a pretty good healthcare system to begin with, whereas states like Kentucky, who are now applying the Affordable Care Act, do not have a great system in place. But what they found in Massachusetts was that insurance coverage reduced mortality rates by 30%. So that's, of course, very significant, but let me give you a sense of its significance. So that's as a percentage, right? So how many how would it affect the raw numbers? How many people's lives might be saved? Again, put aside the health benefits, the peace of mind benefits, et cetera, that you get, not getting bankrupt, all that stuff. We're not even considering that, just the amount of lives that would be saved. For every 830 people newly insured, Massachusetts prevented 1 death per year. Now, as you're about to see, that adds up to a lot of people, right? Now, first of all, credit here to Mitt Romney, who was the governor of Massachusetts at the time, passed this legislation. That's why it's called RomneyCare. He saved a lot of lives in Massachusetts with that law. So credit where credit is due. Now, the new law, the Affordable Care Act, that applies across the country and is very similar to that law passed in Massachusetts, covers 20 million adults, meaning that 20 million adults would now get coverage when they did not have it. Again, these are very conservative estimates. How many deaths would that prevent per year? 24,096. That's amazing. Now, these numbers are, again, very respected journal, Annals of Internal Medicine, thoroughly researched, a huge sample size in Massachusetts, and generally conservative, okay? Now, there are states in this country that have decided that they will not expand Medicaid. That's a choice that they now have because of a Supreme Court ruling. And of course, those are all Republican states and the Republican governors who say that they do not want to take on Obama's healthcare act, that is his signature piece of legislation. Now, in reality, they're costing their states tens of billions of dollars because the federal government covers 100% of the costs for a number of years and then switches to 90% of the costs. It's just an enormous amount of money they're giving up and an enormous number of people who will not have insurance coverage because of the decision made by those governors. Well, how many people does it affect? 5 million, generally speaking, low-income Americans. That's part of the reason why the Republican governors don't care that much, because that's not their constituency. So they don't have a lot of low-income Americans voting for them, so they don't really care. Like, oh, you didn't get coverage, who cares? Well, we should care, because the result of this is that, according to the logic and estimates we've been telling you, in those red states, an extra 5,800 people will die every year as a result of being left uninsured. Isn't that amazing? Those Republican governors just like, oh, nearly 6,000 people dead. Who cares? There's a political point I'd like to make. And if it costs a ton of money, well, okay, that's interesting. That's an argument you can make. Hey, I don't want to blow up my state budget. I'd love to save those people's lives. I just can't afford it. But in this case, it costs almost nothing because the federal government picks it up. And by the way, even the cost of the federal government, Affordable Care Act actually does not add to the deficit. It reduces the deficit. So there is no justification for this. Now, one of the guys who was critical in coming up with RomneyCare and Obamacare was John Gruber. He's an economist at MIT. He doesn't even talk about the deaths. But listen to what he says about their refusal to do Medicaid expansion overall. He says they are willing to sacrifice billions of dollars of injections into their economy in order to punish poor people. It really is just almost awesome in its evilness. And that was before we found out it's costing about 6,000 people their lives. if you're a person in those red states, especially if you're low income, middle income, and you think your Republican governor cares about you, they literally don't even care if you live or die.